Welcome back to Virginia This Morning. This segment is sponsored by Your Benefits Partner, LLC.
All right, if you're looking for affordable health plan options in Virginia, Your Benefits Partner works to connect you with plenty of plans to choose from. Debbie Stocks joins us this morning. Hi, Debbie.
Good morning. How are you?
Well, you know, on Virginia This Morning, we try to be topical, but I don't think we could be much more topical than talking about health care and making it affordable. Obviously, it is the story in the news these days. So let's talk about that and affordable health plans. Are there such things available in Virginia?
Absolutely. There are plenty of affordable plans. It just depends on what you're looking for in terms of a plan. And I specialize in consumer-driven health care plans, which allow consumers to save up to 65% on their health insurance premiums.
All right. Well, that leads me to the question, what is a consumer-driven plan? Aren't they all consumer-driven?
No, actually, a consumer-driven plan requires consumers to be more involved. They tend to shop their
So these
treatments.
wouldn't be the one that if you work for somebody and this is the plan the company offers, then that's not the same thing? That would be different?
Actually, you can get them from your employer as well.
Okay.
It is really based more on the plan itself, and the plan usually has a deductible on it. And because it has a deductible, employees or individuals who have these plans will look at their health care and decide, is this the right prescription for me, or is there an alternative? Or if I have to have surgery, maybe I'll look at the different locations where I can have surgery and say, which one has the best outcomes? Where do I get the best procedure at the best price? Because I'm paying for it. There's a deductible.
So
there.
we're getting people involved
Absolutely.
and making some choices as far as individuals, as opposed to just accepting the blanket plan.
Absolutely.
Okay.
There was a great article in the Wall Street Journal a couple of weeks ago. The CEO of Safeway has been speaking to members of Congress about consumer-driven health plans, and we call it the Safeway model. And in their plan, they have a deductible. The employer gives them some dollars to help them meet their deductible, to help them pay for that deductible. And what the CEO has found is that employees are more careful about their choices because they only have a set number of dollars to spend. They're much more careful about how those dollars are spent and much more careful about the outcomes. They participate in wellness programs more, and he has found that their insurance premiums have stayed flat or even for 4 years, which for most of us, our insurance costs are going up every year. So it's a great model to look at.
Well, let's talk about the consumer-driven health care then. Take it a step further and get some details. How much can be saved on premiums? Because you said some of them stayed flat. Can we save a lot on this?
Right, as much as 65% I see in a lot of cases with my clients. I have a client, for example, we looked at a couple of years ago, and they were spending about $2,000 a month for a family of 3 for insurance. That's almost $24,000 a year. We were able to get their premium to $800 a month. So they saved over $13,000 a year on health insurance premiums. That's a big savings.
That's a lot of money in my bank, baby.
Absolutely. If you saw $13,000 on the floor, would you bend over and pick it up? I would.
Okay, yeah, definitely. I'd dive for it. Consumer-driven health care plans, they include a deductible?
They do have a deductible, and that's why there is savings, because the individual is going to be required to pay some of their health care bills. Now, the good thing about these plans is preventive, which is so important, is covered before the deductible. Those annual physicals, those well child visits, immunization, colonoscopy, mammogram, and so forth are covered before the deductible. So folks can get those treatments as they should. It's simply a doctor visit, a sick visit, an injury, those types of things that individuals would pay for those costs up to a certain amount. And there's always a stop in the sense that there's always a max out of pocket. Once you hit that, the insurance company picks up 100%.
All right, we're going to send this girl to Washington. Taking care of your family while you take care of your business. To connect with Debbie, give your benefits partner a call at 565-3540. And you can always visit online, yourbenefitspartner.net.